My name is Marc Darrow. I practice Prolotherapy. I've treated thousands and thousands of patients over the years. The reason I do Prolotherapy, it worked on me and it works on my patients. Prolotherapy is a surgical alternative that reduces or eliminates pain. We inject the area of the injury, typically with dextrose and lidocaine, to stimulate an immune response to bring cells to the area and rejuvenate the tissue. The advantages of Prolotherapy over surgery are many. Number one, it's less invasive. Number two, it's less expensive. And number three, there's virtually no recovery time. The video you're about to see contains Prolotherapy in action. If you have any questions, feel free to contact me at 1-800-REHAB-10 or my website, www.drdarrow.com.
He's personable, patient. He makes you feel like he's not busy, and he really listens to all your questions and spends a lot of time with you, which I thought really separated him from like an HMO doctor. You know, we spent like over an hour with him just talking about nutrition, inflammation, causes of joint pain. So it was a really good experience.
It was.
It was less painful than I expected, quick and easy.
So this young lady was suffering from what we call Achilles Tendonitis, and the calf muscle becomes fibrous close to the back of the heel and attaches right there, where you can see I'm injecting. And I'm injecting underneath the Achilles tendon. I never inject actually into the tendon because I don't want to compromise its integrity. You saw me first inject onto the back of the heel, or the calcaneus as it's called, where that tendon actually inserts on, and then underneath the tendon going up on both sides. And this should work very fast and very efficiently in terms of the healing process. These tendinopathies typically heal within 3 to 4 weeks. My technique is using a very small needle. This is a 30 gauge needle, which is as painless as it can be for getting a needle stick. The reason I do that is for patients' comfort. I know from having injected my body in many, many areas from sports injuries that I do best with a thin needle, so I started using it on patients that way. The common treatment for this is cortisone. In some cases, actually surgery is done, which is, I think, a terrible way to heal the tendinopathy or tendonitis. That's using a shotgun to kill a mosquito. These cases heal very simply, very easily. Now obviously we want to stay away from surgery as much as we can. It's always a last resort with patients, but I would never recommend having surgery for this part of the body unless that tendon was totally ruptured and had to be sewn together. So I think Prolotherapy is the way to go. You can see it's very quick and the patient does very, very well.
I would definitely recommend Dr. Darrow.